Researchers from the South African Medical Research Council and the University of KwaZulu-Natal are working to find ways to control HIV infections through natural means. This is as South Africa is beginning to see improvements in controlling the epidemic, particularly in reducing HIV incidence, testing and treatment. Dr. Veron Ramsuran is a senior lecturer at the University of KwaZulu-Natal and joins us now. Doctor, thank you so much for your time and for joining us this evening. Doctor, it's been many years of South Africa grappling with the HIV pandemic. We've seen many lives lost, but as time went on, it seems as though South Africa is making good strides with regards to controlling and ensuring that ARV rollouts are happening within our communities. How important is it that we continue this work of ensuring that HIV and AIDS is curbed within our society?
Oh, thank you so much, Katlego. So, yes, ARV rollout is extremely important because this will help us to prevent new infections. ARV is the only type of treatments that we have currently against HIV. Since there's no vaccines, we have to treat HIV. By controlling the virus, we prevent new infections, prevent the spread of new infections throughout South Africa. So ARV rollout is extremely important in this environment.
So, Doc, speak to us about the latest findings. Just talk to us about how you interpret the recent findings, just how they demonstrate the significant progress in controlling this HIV virus in South Africa. And what are the key factors or interventions that have contributed to this positive development?
Right. So we have studied a group of individuals that are able to naturally control the virus despite not taking antiretroviral therapy. So these individuals that are able to control HIV are called elite controllers because they have the ability to control HIV to undetectable levels for extended periods of time, sometimes beyond 1 to 2 years. And we are unable to detect any HIV within them. However, we know that they were infected with the virus. So these individuals are not taking antiretroviral therapy, but have very, very low levels. So there is some sort of protective mechanisms that are present within these individuals. And what we study is how to identify these protective mechanisms, and can we use these protective mechanisms to mimic other individuals so we can determine better drug treatments that are mimicking these elite controller individuals. So our research looked our research looked at determining the DNA of these individuals and identifying new mutations that might be present within these individuals.
So I think that's exactly where I was coming, Doc, in terms of just contextualizing for us exactly what it is that when you say naturally going about in terms of how they control the HIV, is it in what they eat? Is it within the environment? Just speak to us in terms of a context in which how this is done.
Okay, so there's many different factors that can potentially help you to control the virus. So naturally, when somebody gets infected with HIV, if they're not taking the antiretroviral therapy, then they progress with the virus with higher viral loads. So the viral loads is how much of virus that's present within an individual at a given time. And we use a test that identifies how much of virus is present. And these individuals eventually progress to AIDS and eventually demise from the virus. Certain individuals, like elite controllers, have natural protection. And now this natural protection can come about from multiple different sources. So one of them could be that the virus is defective in those individuals, and that's perhaps why the individual is able to overcome the virus. Secondly, it could be that there's some sort of environmental contribution towards the individual protecting themselves from HIV. And lastly, it is the human genetics that might be present within those individuals. So the person's immune system is much more stronger and more protective in those individuals, so that they are able to fight off the virus and keep it undetectable for a period of time. So we studied the human genetics and we try to identify what are the protective genetics that's found in an individual, and can we use this as a therapy in the future.
And did it help, Doc, that because South Africa's got the largest genetic diversity, that within your sample you were able to find more than what would be normal in order to play with?
Correct. So you're absolutely correct there. So it's because South Africa has the highest number of HIV infected individuals that we are able to find these elite controller individuals. So normally the elite controller population is less than 1%. But because South Africa has approximately 7.8 million infected people within South Africa, we are able to find elite controllers at higher numbers simply because we have higher numbers of infections. So this helped us to identify these individuals and try to find out what are the protective mechanisms. Because to study these individuals, you need a large number of them to see if these protective genes are present across all of them.
So, Doc, how long would it then take in order for you to be able to know for sure that these genes are what can be used in finding possibly even a cure in the near future?
So what we've done so far is we have identified the specific mutations that are present within them that give them that unique ability to control the HIV. And what we've done is an observational study to observe this effect and compare them to individuals that progress with the virus at a much faster rate. So the next stage of the research is to identify the mechanisms of protection. So try to find out what exactly does these mutations do, and can we mimic these mutations within other individuals. So this type of research will take us several years before we get to the stage where we can actually come up with a pliable treatment option that may be different from the antiretroviral therapies.
So, Doc, would then it be too soon for us to say or ask what the implications in these findings would have for future policy decisions and resource allocations?
Well, I think what this research does right now is it actually shows us that African descent individuals are very different from the rest of the world. We do have some sort of protective mechanisms that are not duplicated across the world. So it tells us that approaches such as personalized medicine or precision medicine, where we're looking at the genetics of the individuals and we're giving treatment that are specific to that individual, as opposed to getting treatment from generally a pool of medication. The treatment is now designed specifically for that individual, is much more effective way of administering treatment to individuals. So this type of research is showing us that there are special protective mechanisms that do exist in unique populations, and we have to explore these type of results.
Which would possibly then lead to the manufacturing of possibly ARVs that are specifically designed for Africans and manufactured in Africa?
Correct. So that's exactly the aim here, is that we have medications that's directed to the population that works in this population specifically.
In what ways do you see the intersection of scientific research, clinical practice, and just public health policy shaping the trajectory of HIV control in the near future, especially in South Africa? And how can multidisciplinary collaborations and partnerships such as these then further progress in this very critical area?
So I think that's an important area. And I think HIV is one of the main diseases. COVID showed us a lot that was happening around the world. And, for us to get vaccines in this environment was very, very difficult. So it actually opened our eyes to how we need to take charge of our own healthcare in this environment. So I think HIV is another disease that we all know about, and we all should be taking charge of it. So I think this will help us to make large-scale policy decisions that direct us to work together in this environment, because I think that's the only way that we are going to achieve our common goal of eradicating HIV from this environment.
Lastly, Doc, you've made great strides, but just talk to us about some of the challenges and the gaps you then saw within this process.
Yeah, one of the biggest problems is the lack of technology within this environment and lack of skills. So doing human genome sequencing, is that what we did? We looked at the DNA across individuals, and we tried to identify how the mutations within the DNA associate with the specific elite controller status that we're looking at. But this type of technology didn't exist in this environment. So we had to bring it into South Africa, implement it at the South African Medical Research Council, and then conduct the research within that environment. So there was a huge stumbling block by implementing this new type of technology in South Africa, as well as developing the skill sets to run this platform, as well as to analyze the data that comes out from that environment afterwards. However, we've been able to overcome that, and now we've run the project, and now we do have this technology, we do have the skill sets to analyze data. And so looking forward, I think the future is much brighter in that aspect.
It most certainly is a very proud moment, I can't believe, for the South African medical fraternity. Thank you so much, Doc, for the work that you're doing, and we certainly do hope there'll be even more progress in the near future.